our session, please.
Thank you, Yuri, for that brief introduction, and happy to be co-moderator along with you. First, I would like to thank the organizers for giving me this opportunity to be a moderator in the third CIS Orphan Consortium. Distinguished speakers, colleagues, patient advocates, friends from across the globe, good day and welcome. It is a privilege to moderate this session. Rare disease may affect individuals in small number, but within each country, but collectively they impact a lot of patients in the country and outside the country and globally. Delayed diagnosis, limited access to treatment, and fragmented expertise available makes it very unequal access and care everywhere. From beginning or over the years, patient groups have played a very important role in the development of rare disease ecosystem. Internationally, I can recall a lot of activities, and in India also. In India also, the entire rare disease ecosystem started developing with our organization LSDSS and ORDI, where from scratch zero, today there is an awareness across the country. And internationally, if you have to talk about the Rare Disease International, who took the challenge of recognizing rare disease at the WHO level in World Health Assembly, is a good collaboration model, which is an example bringing all the stakeholders across the different countries, patient groups have really achieved it, because recognizing at WHO level is really, really important. And cross-border exchange in terms of information, knowledge sharing is a part and parcel of every activity. And if you talk about certain major groups where they are successful in collaboration, is bringing out the drugs, probably cystic fibrosis trust, PPMD is in a treat NMD. These are the organizations who have set example. With collaboration, we can achieve many things. And even among the BRIC countries, there are network like TB network, which is a very good example in collaboration of research, diagnostics, public health policies, and sharing the best practices. So with this background, I always feel in rare disease, the patient organization plays an important role. They are no longer the end of the healthcare value chain, but they are increasingly becoming the conveners, knowledge partners, policy influencers, and drivers of international collaboration. Today's forum gives us an opportunity to explore such an important question. How can a patient organization become even stronger drivers of global collaboration and ensure that innovation impact each and every patient, irrespective of geography? I look forward to hearing insights from all the distinguished speakers and panelists on the success stories, challenges, practical pathways from our panelists. Thank you all for joining us. And with that, let me begin our discussion. And for today's discussion, I would like to call upon the first speaker, Doreen Wong Rieger, President of APARDO, Asia Pacific Alliance for Rare Diseases, and Canada organization also. I know Doreen almost a decade long. Welcome, Doreen. The stage is yours.
Hello, my name is Durhan Wong Rieger, and I am president of the Asia Pacific Alliance of Rare Disease Organizations. Thank you very much for the opportunity to talk to you, to introduce APARDO, what we have done, and what we are building next. So this is to focus on the APARDO story, our first decade, where we have been able to move from a patient voice to regional system building. We grew from a group of informal advocates who knew each other to becoming a formal regional alliance June 5th, 2015. And we have continued to form the regional alliance, including more stakeholders and more member organizations, and to becoming a platform for what we call country and regional action. Today, APARDO consists of a board which has 6 members and an executive director, 6 board members and an executive director, and a member community that includes national alliances, disease-specific groups, rare cancer organizations, regional patient networks. Our members are from Australia, New Zealand, China, Hong Kong, Taiwan, Japan, India, Malaysia, Philippines, Singapore, Thailand, and Vietnam. We also provide then opportunities for the members in skills development, sharing data, being able to increase policy awareness, in providing training through webinars, workshops, annual conferences, and to have collaboration in peer learning pilots and implementation tools. Focus a bit on our first part of the timeline. We have been existing as a formal organization, as we say, formed in 2015. 2016, we began to come together to focus on the two issues of access to care and treatment and cross-sector collaboration, including policymakers, including healthcare professionals, including industry and other representatives of the governments. 2018 was a very important year because we were building on the Asia-Pacific Economic Coordination, which had launched at that time then an APEC policy dialogue on rare diseases, of which we were one of the key patient organizations. We also in 2018 linked with Rare Diseases International, which was forming to provide momentum towards an WHO resolution on rare diseases, and also then focusing, as we said, with APEC towards national health integration and private sector roles. 2019, we came back together to host a regional conference in Taipei, Taiwan, where we really want to work on how do we coordinate as a PARDO to strengthen the patient voice, how do we create policy frameworks, and how do we help translate the APEC rare disease framework into real action, and how do we continue to build our alliance. 2020 to 2022, as we all know, was a time of COVID, so we retreated from in-person meetings to being able to work virtually. In 2020, a real focus for all of us is how do we help continue to support rare diseases and our members in a time of COVID? How do we make sure that we're going to be able to increase, the access to care and treatment for rare diseases during this period of time where there was also a real lack of in-person health care and in-person meetings? How do we continue to provide social support and support mental health? 2021, we began to focus on how do we ensure that the ecosystem was ready as we're coming back out of COVID to ensure that rare diseases remains a priority in the health systems. How do we focus still on getting essential medicines for rare diseases and, importantly, universal health coverage, ensuring that rare diseases was addressed as we're also refocusing on implementing universal health coverage in our member states. 2022, we hosted a series of webinars in preparation for coming back together, dialogue on essential rare disease medicines, looking at access frameworks, how do we help support community researchers, and how do we ensure then that UHC was being implemented to be accessible to the rare diseases. So our impact was looking at global access and universal health frameworks to be able to impact patient and system realities in our region. 2023 and 2025 in the last 3 years have really been an opportunity for us to come back together again. 2023, we chose to host our first regional conference in Malaysia, in Kuala Lumpur, because Malaysia had adopted a rare disease law and they were working towards implementation. It was a great opportunity for us to bring members from across the region together under a theme of Unite for Rare Disease Impact. We were delighted to have 159 participants from 16 countries and really able to expand the dialogue. 2024 was the year in which the WHO resolution was being prepared for consideration at the 2025 World Health Assembly. And we were really delighted to be in Manila, where at that meeting we were able to encourage Secretary of Health Herbosa to announce the Philippines' endorsement for a WHO rare disease policy. And this was a significant opportunity to actually advance then a PARDO and the region as part of that building towards a global rare disease policy. In 2025, we had the opportunity to work very closely with the movement with the ASEAN countries, the Southeast Asian countries, as they move forward to try to adopt a regional ASEAN declaration on rare diseases. We helped host the meeting in which the declaration was debated, and in which it was, and to help support the writing of the formal resolution towards an ASEAN collaboration. So the regional collaboration for equity we hosted then in Indonesia of that same year, where we could bring forth the ASEAN declaration and also look at some of the other ways in which we could collaborate on diagnosis, on centers of excellence, and also on the ability to focus on joint procurements for access to treatments and also supporting access to care. So what have we done over this decade? Well, just highlighting, we've really increased visibility in terms of policy. National plans are in many of the countries, universal health coverage. We've really been able to focus on diagnosis and genomics from newborn screening, including genomic sequencing and using high speed genomics and improving referral systems across the region, focusing on access to medicines and to care, and encouraging to finance adequate financing for rare diseases. We've introduced care models, which include centers of excellence, but also continuity across transitions from childhood to adulthood, and also focusing on caregiver support. We've been able to encourage the development of tools for collecting data and evidence registries, focusing on country profiles and the readiness of countries to engage in the different needs for rare disease implementation, and most importantly, have positioned patients and patient organizations to be a part of policy and implementation in each of the countries. A big example, of course, was Manila during this period of time, and how, as I said, at the conference in 2024, we were able to really position countries in the Asia-Pacific region to really be a part of the call for a WHO resolution, but also to call for rare diseases to be implemented, embedded in universal health coverage, been able to provide support for technical advances in newborn screening, genomics, AI-enabled diagnosis, which will be very instrumental in terms of improving more accurate and more timely diagnosis, also focusing on what we can do in terms of public health plans that can be developed based on some of the case studies that we were able to put forth. So we've been able to move during this period of time from an ASEAN declaration, which we will use to help frame an Asia-Pacific Alliance network that will also bring together the other countries in the Asia-Pacific region, not only to have joint policies and programs, but to really continue to use APARDO as a platform for shared learning, readiness mapping, and implementation of support across the countries, all of which may be at different stages in terms of rare disease system development, but all which can learn from each other. So we're moving from not just having an alliance and a network, but towards positioning APARDO as a collaboration mechanism for countries and patient organizations that are ready to act. So we want to identify that we have 3 work streams for this Asia-Pacific Alliance that we're developing: diagnosis and data, access and financing, and improving care and capacity. And over the next 12 to 24 months, this is what we're planning to do together: establish the platform so that we're working together in a steering committee, have terms of reference. We want to do is build the work streams that we have identified. We want to be able to map the readiness and priorities for the different countries and across the region, and then hold opportunities for launching demonstration collaborations in diagnostics, in registries, in access case studies, or in training. And we will call for regular progress reports from each of the, in terms of each of the work streams that we've identified from the different countries. We would like to encourage non-member organizations to participate with us, to join our working groups, to host regional dialogues themselves, and also to contribute to the patient journey by providing evidence or registry implementation, and also be able to connect them across the regions, hopefully with the Middle East, North African regions, as well as with the global rare disease community. So this is a part of through our first decade, as we say, from patient voice to system transformation, the work in which we have been able to bring together and debate advanced policy across the region in the different countries. And we see that there, in fact, have been visible developments in policy across all of the countries as they moved, in many cases, from limited or fragmented systems toward having named rare disease policies, registries. Newborn screening has been expanded and access pathways have been addressed. We see in Southeast Asia a real strong progress from the baseline of what policies they've had to be able to improve in terms of their breadth of coverage, but also in terms of the technology and the expertise. We've also seen with APARDO that we're going to be able to help accelerate all of these by working together, by bringing in the best practices from across the globe, and also being able to help support countries to really invest in rare diseases. So this is our next chapter, as we're saying, going from patient voice to regional system building, which we've been doing, from conferences to actually having work streams where we're collaborating together, and from an ASEAN declaration, moving it into an Asia-Pacific-wide rare disease network. Thank you.
Prasanna, we can't hear you. Your microphone is off. Could you please turn on your microphone?
Yeah, sorry. Are there any questions, or should we take all the questions at the end?
I have a very quick comment that, of course, it's a tremendous presentation, and indeed it is a very special aspect. We all represent different countries, but this presentation actually proves a possibility of international collaboration, not only at the global level, but at the regional level as well, in specific regions of the world. And what is especially important for me is the focus on collaboration between patient organizations and authorities, not only in between patient organizations or some collaborations between some institutions or ministries. It is indeed a teamwork, a true teamwork, and this presentation is a vivid example of the need for this international collaboration. Thank you.
Thank you, Uri. I think it was a good comment, and we have to agree that regional collaboration is also important. So we move on to the next speaker. I call upon Christine Mutena, co-founder, Rare Disorders Kenya.
Thank you so much, Prasanna, for your... Can you hear me?
Yes, we can hear you.
Yes, thank you so much for introducing. Allow me to share my screen, please. Okay. Patient organizations are partners of healthcare system. This is a perspective from Rare Disorders Kenya, which is a patient organization that creates awareness and advocates for persons living with rare diseases in Kenya. So we have roughly 130 different mapped conditions that we have done from when we started, and all this is one of our rare disease day awareness photo that we did, I think, in 2018, where members came to for the first time to have a physical meeting as rare disease patients. Then our objectives are we educate and raise awareness on rare diseases in the country. We aim to improve lives of our members by providing a support network, information, and access to diagnosis, treatment, and health services for their rare condition. We also do collaboration with different stakeholders to ensure that we have the best outcomes for our members, including their quality of life. And our fourth objective is to promote research around rare diseases in the country. So I'll just give you a small background on the Kenyan healthcare context, whereby we have limited specialist services and equal access between the urban and rural. That doesn't mean that the urban has a lot, but in comparison, there's a huge difference. High out-of-pocket healthcare costs. We have limited diagnostic capacity because not a lot of the genetics in the country is almost a recent discipline. They have a workforce shortages and lack of information from the healthcare providers themselves. Fragmented care coordination in the sense that registries are siloed between private and public healthcare systems, and even in the public healthcare system, each hospital has its own registry and care coordination, and then also have an adequate awareness of rare and complex conditions and what it is all about. And with this brings a lot of stigma and discrimination. So for us, is where do we do patient advocacy is to strengthen and humanize healthcare by providing our lived experience expertise to the science that's around rare diseases, bringing trust around the community because we are one of them and we are part of them rather than they are part of us. And together we can see how we can better educate and humanize the healthcare system. Continuity of support from diagnosis to how to live at home. So we provide that as well. Advocacy capacity as an umbrella body and also as individual disease specific conditions. And then also give the other stakeholders in the ecosystem patient-centered perspectives on how rare people living with rare diseases go through. Health policy partnership. We have together the Ministry of Health, they have formed a technical working group for rare diseases, which is supposed to create and which is supposed to formulate a guideline and policy around rare diseases, given that the country has no documentation or even registry around rare diseases. So for us, such is a huge win for us coming from our advocacy. Participating in stakeholder consultations, either whether it's with pharma or government or even other patient organizations that we have done. Then advocating for equitable healthcare financing through the National Insurance Scheme health benefit package. Then we also, RDK was also part of the UN declaration for UHC that was done in 2023 in conjunction with other rare disease organizations globally. And for that, we were proud to be a part. Kenya was proud to be a part of that. And then also we highlight the gaps in diagnostics, treatment, and disability support within the different spaces. Then we have also the strengthening of the care delivery systems. This one is where we connect patients to either the appropriate healthcare providers or geneticists, given that we only have 2 geneticists in the country. And also we facilitate referrals and information sharing between members of the same disease specific condition or across the same, like if it's a lysosomal disorder, if it is neurological, if it is endocrinological, we actually share and tell them this is the best place to go where you can get this kind of service. You can even link patients amongst other patients, at least they can share the knickknacks of the daily living and how to overcome them. We also support patient navigation within the healthcare system, promote multidisciplinary and patient-centered care. This is very key because we both know that rare diseases are chronic and they not only affect one part of the system. So multidisciplinary is something that we usually advocate for. And then also providing education and awareness to healthcare workers and communities through CMEs, which is continuous medical education, so at least they can continuously get to hear and learn more around rare diseases. And then the last aspect of what we have done in the healthcare system is improving accessibility and equity. This is awareness campaigns through our Rare Disease Day awareness days and also other disease-specific awareness days, helping families access available services and support systems, either through either through access through other organizations and well-wishers. We are advocacy for affordable diagnostics and medicines. We try and get low fees for our patients when they go to different labs. Addressing stigma and discrimination, this is something that is always continuous. And then supporting inclusion of disability and rare disease needs in national planning. And this is through different bill participations. And then the international collaboration we have done is we have global advocacy partnerships, like, for example, Rare Diseases International or RDI or ARDA, Africa Rare Disease Alliance. We are partners for both to ensure that this collaboration is key and we are going beyond the borders of the country. Research and data collaboration, because we both know that when it comes to registries and clinical trials cannot be done without a porous border. Knowledge sharing within different countries and across globally, so at least you know what is happening outside is what is happening or what is being taken through in the country as well. Then expanding access to innovation and therapies. This is through communication with other agencies. For example, Gaucher disease, we have patients who are being treated free of charge through the International Gaucher Alliance. So compassionate programs and all that is what we also make sure that our members can benefit from. And then in conclusion, an inclusive healthcare system is one where patient voices are not merely represented, but actively integrated into policy, care delivery, and access solutions. We cannot do anything without the patient voice because we know where the shoe fits and hurts, and we are the best people to tell you how to go about in treating us. So we advocate for patient being the center of the healthcare system, or whether it's to see the doctor, whether it's to receive medicine, let the patient know what the medicine is for. If it's clinical trials, let the patient be enrolled from protocol level, not just when it comes to medical access. So in a nutshell, that's what we usually do. And we've done this for the past 7 years, and we are glad to be a part of, I'm glad to be a part of this presentation. Thank you very much.
I would like to thank Christine for this excellent presentation. And for me, it is a very bright example of position of support of patient-centered approach in the healthcare system. Because indeed, I fully agree with you, Christine, that it is the patient who should be in the very center of attention of any healthcare system in any country. And patients' organization go through the whole patient's pathway, starting from the challenges with diagnosis, accessibility of treatment, and you rightfully mentioned multidisciplinary approach in treatment and subsequent rehabilitation. And when I was listening to your presentation, to be frank, this was yet another proof that it doesn't matter what kind of disease, what kind of country. The principles of work are the same. They are similar. And thank you very much indeed, because this has been a very professional presentation and very high quality of your work as an organization. Thank you.
Thank you, Yuri, for the comment. Thank you, Christian Mitena, for a beautiful presentation. Now I call upon our next speaker, Alison Zheng, who is the founder and president of Chinese Organization for Scleroderma Condition. Alison, over to you.
Thank you, Prasanna, for the introduction. So I want to make sure if anybody can hear me.
Yes, you are.
Okay. Good afternoon from China, dear colleagues. I'm Alison Zheng from a patient-led organization for scleroderma in China. Thanks to the
Alison,
organizer.
can you expand the PPT in a view mode?
Can you see?
Yeah, it is not in a presentation mode.
I think it is. How about now?
Okay, now it is better.
Okay. But
You
I
can
need to
enlarge it bit more.
wait a moment. I will start from the first page. How about now?
No, still it is not in presentation mode.
Why? Let me try again. I'm sorry, I don't know what happened. How about now?
No, still it is not, but you can at least, increase the zoom here and see.
Mm, I don't know why, but why? How about now?
No, nothing happened.
I don't know what to do with this. So is there anyone can help me?
Okay, can you just increase the zoom at least and make it slightly bigger? Now it is at 76%, right side bottom.
Okay. So here is my personal introduction. Uh, eh? So, but I changed my presentation mainly will consist of the following 4 parts. But I say the pro stream, my slides didn't move. So I just go to continue. Let me start with some context. General context. Globally, over 7,000 rare diseases have been identified in China. The rare disease population is estimated at over 20 million. This is a large community requiring substantial attention and support. I, unlike some other countries that define rare diseases by prevalence rate, China has adopted a catalog-based mechanism. The National Rare Disease Catalog is developed in batches with expert committees providing technical support to ensure scientific and rational selection. In 2018, China released its first batch of rare disease catalog, covering 121 diseases. In 2023, the second batch was released, adding another 86 diseases. Together, the 2 batches cover 207 rare diseases in total. This catalog system provides a clear scope for clinical practice, insurance coverage, and research funding. Of note, over 90 rare disease drugs have been included in the National Medical Insurance Catalog, significantly reducing patients' financial burden. In 2026, panoramic insight into China's rare disease patient communities made by a hub institution provided the most comprehensive data to date. At present, there are a total of 161 patient organizations for rare diseases. Among them, 122 are included in the two catalog, and another 39 are internationally recognized as rare disease, but have not yet been included in the Chinese rare disease catalog. Notably, the majority of these communities exist long before their diseases were officially listed. Policy followed patient action, not the other way around. 85 cataloged diseases still have no patient community. They are either diagnosed at extremely low rates or lack of patient leader. We can observe that the emergence of these patient organizations over the past 20 years has been as the shown curve. So this completes the landscape of the rare disease patient organization. Now let's turn to what they actually do. Chinese patient organizations are highly active. Their activity is not driven by policy catalogs. It is driven by patient self-rescue. Let me outline 4 key roles that these organizations play. The first one is that patient organization plays a role in diagnostic guidance, helping patients shortening the diagnosis time and reducing misdiagnosis.
Excuse me, Alison, I think your slides are not moving. It's stagnant.
I see it, but I can not control it.
Okay.
I don't know why. So.
Okay, go ahead.
Okay. Through China's National Rare Disease Diagnosis Network of 419 hospitals combined with patient community referrals, the average time to diagnose a rare disease has been reduced from 4 years to just 4 weeks. This is a remarkable achievement. For example, patient organizations build expert networks to directly collect suspected patients to specialists, dramatically shortening the diagnostic journey. The second role is that of a policy advocate who brings the voices of patients into the process of promoting access to medical insurance and negotiating drug prices. Between 2020 and 2023, 49% of patient organizations listed policy advocacy as a core mission. This marks a fundamental shift from internal peer support to active external engagement. Hemophilia communities have been deeply involved in local insurance negotiations. SMA communities helped drive the inclusion of Spinraza into the National Insurance Catalog through tireless policy work. The third role is direct support. Patient organizations provide financial aid, psychological support, and help patients manage their treatment. One example is the Rare Disease Medical Assistance Program launched by Illness Challenge Foundation in 2018. It is China's first nationwide charitable assistance program covering the entire catalog of rare disease. At the heart of this program is a multiplayer model. A patient's total medical cost is shared across, let me wait a moment. I don't know why my cat, I'm so sorry about the technical problems. Okay. At the heart of this program is a multi-payer model. A patient's total medical cost is shared across basic insurance, supplementary commercial insurance, charitable funding, and patient self-payment. This model reduces the financial burden on any single party and has been replicated in provinces. As of June 2025, the program had assisted over 5,270 patients across 30 provinces, distributing more than 55 million RMB in direct aid and covering 120 rare diseases. It serves as a vital safety net in China's multi-layered rare disease protection system. Beyond financial aid, patient organizations collect and share real-world feedback from patients about daily medication adherence, side effects, and quality of life. This feedback is used to improve treatment protocols, inform policy advocacy, and strengthen the evidence base for further drug approvals. Together, financial support and patient-driven feedback help create a more complete support system for rare disease patients. The fourth role is research engagement. Patient organizations are no longer just passive recipients of clinical trials. They are active partners in drug research and development. Chinese patient organizations now help recruit participants for clinical trials, collecting real-world data, and provide patient-reported outcomes that matter to regulators. For example, some rare disease communities have co-designed patient registries that feed directly into natural history studies, accelerating the development of orphan drugs. In the case of SMA, patient organizations gathered real-world evidence on treatment access and quality of life, which informed both clinical trial design and the post-marketing evaluation. By bringing the patient voice into every stage of R&D, from trial design to endpoint selection to recruitment strategies, patient organizations help ensure that new therapies are not only scientifically sound, but also truly relevant to those who need them most. Next, I will introduce the main activities of our patient organization. But first, a quick overview of the disease. It is an autoimmune collective tissue disorder that can either localized or systemic. It mainly affects young women and children. The exact cause remains unknown, and there is currently no cure. In fact, even in China, only 2 drugs have been approved for this disease. In response, we founded our patient organization in 2016. Over the years, our work has centered on 4 main areas where we have achieved tangible results. Let me briefly introduce the 4 major areas of our organization. First is the patient services. We provide direct support to patients through online communities, psychological support, and disease education materials. We also organize patient-doctor conferences and have developed a mini program on WeChat to help patients access reliable information and find specialists. Second, with the patient empowerment, we help patients take control of their own health by conducting quality of life surveys and training them to articulate their needs to doctors, policymakers, and researchers. We also facilitate patient interaction with diverse stakeholders so that their voices are heard, not just internationally, but in every decision that affects their lives. The third one is industry development. We work with hospitals, research institutions, pharmaceutical companies, as well as other global partners to advance scleroderma care. We have co-initiated a national multidisciplinary alliance and co-hosted major academic conferences. Our goal is to build stronger bridges between the patient communities and the medical research ecosystem, and to promote progress and development across the entire field of this disease. Fourth is the advocacy. We raise public awareness through social media campaigns and public events. We also submit policy recommendations to advocate for the inclusion of scleroderma into the outpatient special disease insurance catalog in China. Through advocacy, we push for systemic change that benefits all patients. These are the 4 pillars of our work. Now, let me move to the final part of my thoughts about the potential areas for collaboration. I think as rare diseases are a global challenge that no countries can solve alone, as patient organizations, we must do everything possible to unite. We need to raise our collective voice on the world stage. We need to help each other share our experiences and wisdom, and also learn from successful initiatives across borders. Together, we can advance treatment access and drug development worldwide and promote international collaboration on disease research. So this concludes my presentation. Thank you for your attention.
Thank you very much indeed, Alison. I believe that I would like to highlight those dramatic changes that are currently happening in China. And thank you very much for your perspective from the China viewpoint. And you also mentioned serious figures about better access, more equal access for medical care for rare and orphan disease patients. I believe it is a very positive signal for all of us to learn about what's going on in China. And of course, your patient organization it also lays a very strong foundation, because we should always remember about patients themselves. This is very important. Thank you, Alison.
Thank you, Alison, for that wonderful presentation. Although we were not able to see some of the slides, we missed it, but I think we got what you are supposed to say. So now I call upon our next speaker, Kelly Du Plessis, founder and CEO of Rare Disease South Africa, and my friend. Welcome.
Thank you so much, Prasanna.
Kelly,
Thank you so much. I'm going to try and share my screen, but I see that I do not seem to have that option. I'm not sure if someone can please grant me access to share. There we go. I see it has come up. Thank you.
Yeah.
I see it's doing the same thing that the previous, is it coming up in presentation mode? Prasanna, can you confirm if you can see my slides, or are you seeing my entire screen?
Kelly, could you switch to full screen mode?
Sure, just give me 1 second. You can please just stay with me for 1 second while I try get this to work. I don't know, the Zoom gremlins are obviously out and about today. There we go.
Okay, I think.
Perfect. Thank you so
Yeah,
much.
fine.
Right. So thank you so much for the opportunity to present today. I'm going to be presenting, obviously, on a more practical approach with regards to the role of patient organizations in rare diseases. My name is Kelly Duplessis, and I am the founder and CEO of Rare Diseases South Africa. We were founded in 2013, and we advocate for people living with rare diseases and congenital disorders to experience greater recognition, support, improved healthcare services, and better quality of life. In the South African context, 1 in 15 South Africans is impacted by a rare condition, which estimates approximately 4.2 million South Africans. And as a result, we have realized that there is, collectively we are relatively common, and there is a definitive need for strengthened advocacy, focusing specifically on rare diseases, separate to NCDs, et cetera. Our key focus pillars are advocacy, patient navigation, and community engagement. So I'll be speaking about the broader context of patient organizations and their role within the healthcare space, specifically focusing on rare diseases. And the first thing I think that's important to highlight is that policy is only meaningful when patients can feel its benefits. So patient organizations often become the bridge when systems are fragmented. We are not the hospitals, we are not the service providers, we are not the clinicians, but we are very often the first place that people come when they are needing access to all of those things. And as a result, we have a very, very critical and meaningful role to play when it comes to bridging the gap between patients moving from a pre-diagnosed or newly diagnosed phase into the phase of actually accessing care. It's important also to realize that practical things such as missed referrals often will result in delayed diagnosis. Funding decisions and treatment navigation often can become an access barrier, and the data gaps that exist within our healthcare systems result in patients becoming invisible. And those are things that we are all expected or supposed to be changing as patient advocates. So what is it that we actually do? I think that there's this perception that from a patient advocacy perspective, we're all always just about awareness. And actually, we provide a ton of practical system support. So advocacy, which is evolved around changing the environment around the patient, to navigation, which is helping the patients and the families move through the day-to-day systems, to the community, which is reducing the isolation and building trust, through to evidence and becoming that evidence base, turning the lived experience into patterns that are easily understood, and that those patterns can then be utilized to drive policy change. And then lastly, it's driving accountability. So keeping the systems connected to reality. And in the rare disease space, patient organizations often become part of the implementation infrastructure, simply because of the fact that we have an understanding of the broader need and the patient journey from an intimate perspective, but also because we essentially form part of the massive accountability partnership that is often required with any healthcare system integration. So it's also important to realize that the rare disease journey is never linear, and patients can fall out of the pathway at many different points. So whilst we would love for access to be a single event that happens, it doesn't always happen like that. You've got numerous different elements that form part of the patient journey, and all of those elements become a critical integration factor in terms of patients accessing services, accessing treatments and interventions, and generally just accessing support. So some of those pathway intercepts include things like recognition, being referred, being diagnosed, managing to access services, care coordination, long-term support, and adult transitioning. So all of these develop a strong system, and that strong system is needed to ensure that the routing happens, that you've got continuity, that there is data collection, that social support and financing remain in place, and that patients are able to follow through that patient journey and be able to access all the things that they need without necessarily having interruptions along the way. So in terms of the lived experience, it's also very important to realize that the lived experience is not simply an anecdote when it reveals a pattern. So we as patient advocacy groups will often be able to see the connecting themes and the connecting thematic areas that ultimately result in us being able to underline and determine what the critical barriers and entry points are in terms of the rare disease patient journey. So if we look at things, for instance, we will be able to pick up themes where diagnosis is delayed, where referrals have broken down, where the access pathways have failed, and we'll also be able to determine what things matter most to patients when it comes to making appropriate decisions. So patient organizations can help make data ethical, useful, and also connected to the real environment for real improvement. So if we look at our engagement with many of the healthcare systems integrating partners, working with your national health departments, with your funders, possibly your insurance mechanisms, etc., it is often the patient organization groups that will bring these thematic areas to light and will be able to say, you know, for this cohort of patients, these are the reoccurring things that seem to become problematic. So we are not only the drivers and the implementers of solutions, but also very often are the drivers of actually identifying and correctly quantifying the state of the problem. And then also partnerships require trust. Patient organizations carry responsibility, and collaboration is necessary, but at the same time, our independence needs to be protected. And these are also very, very important things. Things like good governance, transparency, ethical partnerships, responsible data use, conflicts of interest controls, and accountability to patients. Those are all very, very important aspects that come into the process of actually engaging with multi-stakeholders and patients being part of the larger healthcare system partnership integration. And it's important to understand that partnerships must strengthen the patient voice and not replace it. And I think this becomes one of the fine lines in healthcare integration systems, is that very, very often the people that are there presenting and coming forward as speaking on behalf of the patients actually are not necessarily given the agency that is required for them to do so appropriately. So importantly, cooperation should connect patient organizations as well. We have so much to learn from each other. Even listening to the speakers before me in this session, we have, you know, everybody's doing great things, and there's so many that it doesn't necessarily mean that we have to bang our own heads against the wall. There's so many ways and means to learn from each other. Shared learning on things like registries, health technology input, access models, advocacy tools, and patient-centered implementation all become such an imperative part of how we can guide and help each other. It's also very, listening to Doreen speaking earlier about the APADO region and the vast majority of countries and the vast region that they're having to work across makes you realize that there are certain ways and means to be able to learn from those organizations, that you don't have to reinvent the wheel from scratch in your own region. Having regional collaborations, being able to engage, having good umbrella organizations, being able to engage with people from similar demographics to the area that you might be working in, all makes a really, really big difference in terms of being able to think smarter, be more efficient, and ultimately serve patients in a more functional and effective manner. So I think as a closing point, it's important to remember that patient organizations are not an optional add-on. We shouldn't be invited to the table as a last resort. We are essentially, we also shouldn't be requested to help build the table. We are the table, and nothing should be done in healthcare without patients at the center. We are part of the infrastructure needed to make rare disease policy real. And we need to be able to engage with people formally in order for us to be able to get that done. Patients shouldn't only be invited to tell stories, they should be invited to shape the system, and that is my closing point. So thank you so much, Prasanna, for the opportunity.
Thank you ever so much indeed, Kelly, and I fully agree with you because we are not just patients' voice, we are full-fledged participants, an integral element of any healthcare system, and this has already been mentioned by Christine, for example, and I fully agree that our position should be taken into account by healthcare authorities when they plan their decisions in the healthcare system, because we, the patients, it should be the patient to whom the healthcare system should be servicing and not just to service itself. It is the partnership and the interaction and mutual enrichment with our experience between patients, organizations, clinicians, and healthcare. By the way, we talk very little about clinicians, about doctors, and I believe we should mention doctors because we collaborate with the doctors community very tightly, and this teamwork is the one that enables to achieve great results in the accessibility. We don't have too much time left, dear colleagues, so I give the floor to Prasanna again, please.
Thank you, Kelly. Again, that wonderful presentation as usual. I agree with you about the closing remarks, which is very good. Now I call upon our next speaker, Olga Germanenko. Hope I have pronounced it correctly. She's a founder and director of families of SMA Foundation for patients with SMA and NMD, vice president of International Patient Organization, member of the Expert Council on Rare Orphan Disease under Healthcare Committee of the State of Duma of the Russian Federation, and also a member of Expert Council of Circle of Kindness Foundation Russia. Welcome, Olga. Stage is yours.
Thank you very much. I would be speaking without presentation. So actually, it's very hard to add anything to whatever been we discussed already. But I'm speaking English now, so that's why I'm choosing English. But if you prefer, I can choose Russian. Yeah, okay, good. So for me, it's better that everyone can understand it. So that's why I'm choosing that. Okay. So I would like to say a few things because what I hear from previous speakers is actually very important, and it shows two different perspectives: how is the national organizations working and how the global organization is working, and representing sometimes the national organization and the national landscape, it's more sufficiently moving forward their political changes or access changes in a particular territory or particular country. But I think that also international collaborations is really a key for a national organization to grow and to have more experiences, because it's actually the key of learning, of increasing your capacity in terms of patient advocacy as well. So I think that example which we have in SMA Europe, which is an umbrella organization, consists of 30 organizations currently today, is given this opportunity very widely, and it gives a lot as a collaborative effort for all the members, including our Russian organization, because it teaches us how we can define and how we can differ the work and the task we do in a national level and what we can do on the global perspective. So it's open for us also the opportunities to collaborate, for example, with industry in a much more high level. For example, to participate in a global clinical trial design, to share the global perspective of the patients, taking care that clinical trials not only happening and running in the countries which is usually they run, like developed countries, so-called, but to open the possibilities and be the voice of the global community as well, and provide some support for clinical trial readiness in the countries which is not in the list right now, but hopefully hopefully will be more and more countries who is participating there. Also, I think that it's important thing that we all together learn the problem of each countries, because sometimes it's quite different. And what we see as a global community, that actually there is a huge gap in between different territories in the world, right? So what we have and discussing in SMA world, in for example, in European landscape, is a combination therapies, not having only one treatment, but also some additional treatments for our kids and adults. But when we talk with our global partners who is living in, for example, African region or Asian regions, South America, so then we see that how bigger the gap over the time getting, which is really for me very worrying situation, because it's from my perspective, it's really the common global task for the patient communities across all the globe to combine efforts not to let any patient with a rare disease in any country be without any support. So that's how we can also collaborate to increase the access, for example, for treatments in different countries. And there is a good example of generics, for example, and the scheme that WHO having for supporting this generic production in the countries who cannot afford very expensive orphan drug treatments. So the examples we can see now in some countries of Latin America, in Russia, in India as well. I'm talking about the SMA field. Another thing I think is very important, that access unequal in the countries is not only in treatment access, but also in terms of diagnosis and care. And here I would like to mention what Yuri said as a comment last time. It's about the collaboration with the healthcare professionals, because sometimes growing capacities of multidisciplinary care, meaning to collaborate more deeply and more wide, more consistently with the healthcare professional globally. And here is a great example of, for example, organizations like TreatMD, already mentioned by Prasanna at the opening of the session, which I think are doing a tremendous work of organizing in neuromuscular field, which is a part of rare disease community, of course, the educational webinars, but also educational in-person events like workshop, SMA or Duchenne or DM1 or whatever, FSHD, workshops for clinicians, which is actually paid, and it's open for the doctors. But what is happening right now, it's a few initiatives going on to help to increase these capacities also in the countries which is, I would say, left behind. I'm sorry, maybe I'm too straight, but I mean Asian countries, ex-USSR countries, because also in our consortium part, right, there is not all the time we can see equality in how fast the diagnosis is there. What is with the newborn screening? It's not everywhere. What is the level of the education of doctors, or the opportunities to provide some additional support for the patients? So I think that is a really important task also for the patient organization to be part of it. And I really touched what Kelly was saying, because sitting on one table or being invited to the educational events, not only sharing the patient story as is usually happening, we as a story, no, as an equal stakeholder with a not only perspective of the living with the disease or living with a kid with the disease, but also as the patient expert, which is, I think, very important terminology we can use. Patient expert is not just a patient, is a person who is really understand the landscape of the healthcare system, of the policy, of advocacy, and who is able to talk not only on behalf of himself or herself, but also on behalf of the community itself. And for that, of course, we need to, based on the data, it's what in ESTIMA Europe, for example, we called advocacy-based, evidence-based advocacy, meaning that we try to translate patient stories into the meaningful data we gathered from the patient community in Europe and also worldwide, which is now happening. So I think that that's a few examples I would like to give, which is actually bring me to the last point, which I want to make in also reminding of time, that actually this consortium is also could be the very good platform of collaboration, global collaboration, where we can not only share, but also to build some initiatives or to structure some maybe map of the problems which is happening in our regions, not only countries, but regions, and to see what we can do as a consortium, as a patient organization, what we can support. So that's what I think we can do next. And thank you very much for inviting me and opportunity to learn also from you guys. Thank you.
Thank you very much, Olga, for your position. And indeed, the first sign of help is for us to exchange our experience, our knowledge. And despite today's challenges, political, economic challenges, and so on, I'm pretty sure that collaboration between patients' organizations will stay as high as it is, because we are united by the same cause to help the patients. Thank you.
Thank you, Olga. I really like your comment about collaboration. After my last visit to Moscow, I really learned a lot and taken back the concept of circle of kindness. Today, written to Prime Minister office and following it up, hope so. Okay, I think the collaboration is already started. Thank you so much.
Yeah,
Now
I
I call upon.
I wish you will be successful.
Hope so. I need your inputs. Now I call upon our next speaker, Yola Sagia, founder of Indonesia Rare Disease Organization.
Hello. Yeah,
Yes.
thank you. Okay, let me share the material. Okay, hold a sec. Okay, could you help to share my presentation?
Are you getting the option share button on your screen?
Could you help? Yeah. Okay, I can.
Do you see the share button below your?
Yeah. Yeah. I see the button, but hold a sec. Oh. Thank you for this opportunity for me and also with all our members from Indonesia. Okay, this is me. I'm the founder of the Indonesia Rare Disorders, and this is my daughter and my son. My daughter has Treacher Collins syndrome. Okay, this is our platform. Who supports the parents and relatives who have children and family members with the rare disease. Okay, and this is my friends, my colleague who found the RD, the DERD. Yes, this is me and my colleague Koko Prabu and Winanda Sabutri. We have a child with the rare disease. My daughter has Treacher Collins, and this is Koko Prabu has Cornelia de Lange syndrome, and Winanda has a daughter with the Cray-Ducat syndrome. And this is the domicile mapping chart. Our member in Indonesia Rare Disorders, right now the number is more than 330 people. Then currently our association has more than 330 members who are parents of rare disease survivors, and the survivors are mostly children aged 2 until 10 years old. Then there are also teenagers aged 13 to 17 and adults aged 20 to 30. And this is in the last 10 years, quite a member have also passed away due to complication from their syndromes, such as shortness of breath, sepsis or infection, heart abnormalities, tachycardia, and many so on. And the types of rare disease registered in our association, like Treacher Collins syndrome, Cornelia de Lange syndrome, the George Edwards syndrome, Dandy Walker, spinal muscular atrophy, Angelman, osteoporosis imperfecta, Walden syndrome, Crozon, and Apert, and many more. Among these rare diseases, the largest number of survivors are those with Cornelia de Lange and spinal muscular atrophy. Most of these survivors are empowered, even though they need assistance and use assistive device such as wheelchair, prosthetic legs or arms, special shoes, hearing aids, and so on. Although some of them are empowered and capable, many still face difficulties in accessing services and facilities in general, especially those living in remote towns or villages, such as difficulty of reaching a large hospital with more adequate facilities because they are far from where they live. Unavailability of healthcare workers who understand rare disease, including medical equipment and health technology. So treatment is often inappropriate and misdiagnosis occurs. Difficulty in obtaining certain medications and special food or drinks, such as milk for survivors of maple syrup urine disease, which must be purchased from outside country. Uneven implementation of inclusive education access due to the lack of difficulty of finding human resources capable of handling rare disease survivors. Difficulty also finding employment for survivors of rare disease. There are still myths circulating in society related to the culture and customs of a particular region, which view survivors of rare disease as a cure or something mythical. Bullying practices still exist in their residential environment and in the place where they are active, such as school and even within their own families. Given this condition, our association provides a space of rare disease survivors and their families to share useful information with one another, a place where they feel less alone and delivers up-to-date education so they can equip themselves with positive information and grow and develop well. We also regularly hold activities with association members every few months and organize events for special occasions such as Rare Disease Day, the association's anniversary, International Day of Person with Disabilities, and others. During these activities, we include many fun activities that also help hone the creativity of rare disease survivors. Yeah, here are some photos of our activities over the 10 years we have been together as in our organization. Yeah, this is the picture of our first anniversary. And this is the second our anniversary. There's a lot of members. And this is we were being a guest star on the Opini Public program on a private TV channel. And this is Run for Rare. Yeah, we had the event with the runner community, and also we have fun with the pets. We collaborate with pet lovers in Indonesia, and this is also we had a guest. We be the guest star on program private TV channel, and this is the our activity to watch party, The Wonder. Yeah, I know. I think all of you know the movie, right? Okay, and this is opening of Prodia CSR activity. Prodia is one of the national laboratory give us the genetic testing with CMA, microarray analysis, and WES, whole exome sequencing with free, no charge at all. This is the celebration of International Day of Persons with Disabilities with the Minister of Social Affairs. Also, this is the celebration of International Day of Persons with Disabilities at Candi Borobudur, Yogyakarta. Yeah, okay, go back. Yeah, through today's activity with BRICS, we sincerely hope we can work together and collaborate well and sustainably toward a world that is inclusive and disability friendly, especially for rare disease survivors and their family. Our hope through BRICS we can initiate communication with the Ministry of Health and Social Affairs in various major forums regarding rare disorders, and also hold regular meetings for each country in BRICS to share what will be and has been done within that time frame or an ongoing basis. And we can provide free educational programs for healthcare workers, educators, caregivers, and volunteers willing to support rare disease survivors. And also we can share information on clinical trials, nutrition, orphan drugs, and assistive devices available in each country as a means to help rare disease survivors live and grow optimally, and also encourage our government to care through the network of cooperation between nations that has already been established. This is the brief glimpse into the story and experience of our association for rare disease survivors in Indonesia. Thank you for this opportunity given to us to be a part of BRICS, CIS Orphan Drugs, and to continue voicing the needs of rare disease survivors, because we believe we are rare, we are real, and we are empowered. Thank you.
Thank you very much, Yola. Thank you very much indeed. It is a very important, a very interesting presentation. And for me, what is important is that it is not only medical questions, medical issues that are important for us. If we look at the life of a patient in a comprehensive way, it is accessible environment. This is also attitude from communities, from people who live nearby, and it is also joint communication, because a patient's organization is like a big family, and it was a great pleasure for me to see the photos and smiling faces here in Russia. We also have similar meetings between patient organizations where we are together just to communicate, just to talk to each other, to play some games, to have some celebrations, and even provide psychology support for each other. This is especially valuable. Thank you very much. Your experience is very valuable, very interesting.
All right,
Thank you.
Thank you. Thank you so much.
Спасибо.
Thank you, Ella. I think a lot of similarities and similar activities by all the patient group. I correlate your run for rare. We also conduct a program called Race for Seven. Race for Seven, last 11 years we are conducting in India. We conducted in 21 Indian cities, and Race for Seven symbolically representing average diagnosing period of 7 years, 70 million estimated patients.
Yeah. Thank you.
And,
Thank you so much.
That's all. Okay, good. Now I call upon our last speaker, Mr. Yuri Julev, co-chair of the All Russian Patients Union, president of the Russia Hemophilia Society, Russia.
Thank you very much, Prasanna, for this introduction. I hope that my presentation is readily visible for you, and I can take time to tell you about Russian experience. Of course, I'm not going to dwell into every tiny details of activities of patients' organizations. Probably I will focus on operation of the largest patients' organization, the All Russian Union of Patients, and our interaction with governmental agencies. But the name of my presentation, the very title, actually gives some impression of the journey that we have already made, creating a patients' organization to support each other, being like a big family, a family that works to provide high quality medical care and collaborates with governmental authorities. This is how I would like to call the main milestones in our history. As I mentioned in the beginning of our session, one of the first patients' organizations were created in late 1980s, and one of the oldest organizations, it was back in Soviet Union times, The oldest organization was the Hemophilia Patients Association in August 1989. In the year 2000, we established large patients organizations in the area of oncology, multiple sclerosis, diabetes, and then patients organizations for orphan and rare diseases started to appear. And the ninth year for us was a milestone because in 2009 we organized the All Russian Union of Patients, and indeed it became a serious milestone because it was the general umbrella organizations that appeared. They are not bosses for us, but rather they are a platform, a foundation of our activities that enable us to exchange experience and work as a single team to engage in a continuous dialogue with medical community, with politicians about patients' needs and further improvement of the healthcare system. And we can now assume that indeed patients' organizations became an integral part of a systemic dialogue, not just a patient's voice, but as we said previously at this session, where we all agree, all the delegates from different countries, that we are becoming an expert community. We are listened to, we enjoy their attention, and they understand that we are also experts in our field, and we suggest things that are aimed to positive outcome to make our healthcare system more patient-centered. And here are the leaders of our All Russian Patients Union. And also Irina Mesnikova is the head of the Russian Society for Mucoviscidosis Patients, and also she is the head of All Russian Society of Orphan Diseases. Jan Vlasov represents multiple sclerosis. So we all come from different backgrounds, from different nosologies, but nevertheless the methods of work are the same, as we already heard today from the presentations of our distinguished colleagues from patients' organizations from other countries. This is the diagram of the key areas of our attention, and let me start with education, trainings, and information. And of course it is about advocacy, working with patients, not only education but also advocacy. And later I will tell about this. We organize special workshops for patients. We call it in Russian schools, but they are rather called in Russian workshops. And of course, the knowledge that patients have and increment of their education level is no less important task than increase in the medical care accessibility. Also, access to drugs is important, and here is another reason to mention the Circle of Kindness Charity Foundation, and our experts are present in the expert board of the Circle of Kindness Foundation, and our activity jointly with other doctors that matters here. And of course it gave a huge impetus to the decision of the Russian government, the presidential decree on the organization of the Circle of Kindness Charity Foundation. Defending patients' rights, of course, is the main area of activity of any patient's organization. And here it becomes a kind of systemic approach and expert effort at various sites. I will mention them later. And we should always remember that we are the voice of the patient, and we are here to protect their interests. And Of course, when we start saying that medical care is provided today to rare disease patients, for every rare disease, a multidisciplinary approach is important. Not a single doctor. Mostly it requires a multidisciplinary board opinion to provide better pathways for the patients, and not only in terms of drug accessibility, but also in terms of psychological support, ability to receive normal education, and so on, including the authorities who are responsible for that, all the relevant authorities. Speaking about the scope of discussion, it is not only circle of kindness. Our focus on orphan drugs is very high because we organize Orphan Forum every year, and it is a centerpiece of further discussions of how we can further improve medical care for patients with rare diseases, and the advocacy and protection of patients' rights. And we are building now a certain public pool of experts' positions in order to make sure that important decisions are made, those that have quite costly consequences, but we all understand that curing orphan diseases is really a costly initiative, quite pricey, but these spendings are actually about the life and the quality of life of many rare disease patients. And since 2009, we can understand that the Russian Union of Patients has expanded greatly. You can see a huge increase in the number of member organizations. All these organizations, even if they are not our members, they are involved in the project efforts and other efforts of our union. You can see the number of the patients represented by these organizations, and it is a very interesting initiative of the Russian government that it starts to support not-for-profit organizations, including patients' organizations, through granting policy. And we have a lot of workshops performed annually. And the pool of expert work is also quite substantial. And of course, interaction with professional medical community, including research. And we also need to mention our interaction with the pharmaceutical industry, both Russian and international. And we can talk about our clear work at every level of authorities, at the level of the Commission for Disabled Needs, the Human Rights Commission, and we also can impact the Special Expert Council, the Board for Rare Diseases, also the Special Committee of the State Duma, State Parliament of the Russian Federation, for protection of people's health, and also we collaborate at different sites with institutions like Ministry of Health, the Health Supervisory Authority, the Ministry of Labor and Social Protection. And as part of our work with these institutions, we also expanded at special expert sites, special boards, and I will tell you about this at the next slide. And this continuous communication with the authorities actually enables us to make sure that certain decisions are made. And also we are interacting with other regulatory authorities, different foundations that are mentioned here at this slide. But I will move forward. We don't have much time left, actually. And briefly, I want to tell you about creation of patients' boards under the auspices of different authorities. The Council of Patients Organizations under the auspices of the Federal Ministry of Health has been organized. And also patients' councils have been created in the Russian subject regions. And also we have the Healthcare Supervisory Authority. We also have a similar board with them. And here is where we can reach yet another level of quality with our interaction with the authorities, because this results in different documents issued, and this is indeed a new form of productive dialogue in a very formal shape, in the best sense of this word, formal in the best sense of this word, because it is about very good systemic approaches to the dialogue. When patients' organization informs about the problems and authorities take this into account, discuss potential ways to resolve these problems, and then it is resulting in specific and concrete decisions and initiatives. So I believe it is a very good example of what we are currently doing here in Russia. And also I mentioned workshops for our patients, depending on the nosology. They address different problematics, but mostly it is similar for any workshop. It is about providing the information about a specific disease, today's method for diagnosis, treatment and rehabilitation, to improve patients' commitment to treatment, and of course we provide legal information about patients' rights and the methods how these rights can be defended. We also collect data about the day-to-day problems of our patients, because it is a possibility to talk in person, and then doctors need to know about these problems. And anyway, it results in specific actions. It is about direct communication between the patient's community and the doctors, and also sometimes it's regional authorities, regional ministries of health, and it is a direct dialogue. It is very important, because it is a two-way journey. It's not only doctor or medical authority person who receives information from the patients, but also it is a possibility for the patients to receive very important information from doctors and governmental authorities. And it is also about ability to find new people, new volunteers and activists, because patients' organization cannot work without influx of new people who are willing to help. And it is at these kind of workshops where we can find these socially active people who are ready to help. And our union conducts a lot of targeted events. They are listed here on the slide for different nosologies of social significance. It is the forum, the annual Orphan Forum that I mentioned, also a cardiovascular forum, because it is cardiovascular reasons that are the primary cause of death in the population. Obesity forums, and also it covers various infectious diseases. Another very important example that we can make innovations as readily available for the patients as possible, and Mostly they should be free of charge and submerged into the governmental healthcare system, and also forums for different nosologies and themes. And this is the annual set of events that enables us to reach our All-Russian Congress of the Patients, where we can see the statistics of patients' organizations. We have always the highest level of governmental representatives, the Ministry of Health, the Healthcare Supervision Authority, pharmaceutical companies, insurance, mandatory medical insurance body, and so on. So in general, we are very pleased that this Congress was called the most representative and large-scale events in the healthcare systems. So we are getting prepared for this Congress, and on top of the plenary session, as part of our preparatory work, we also perform about 40 annual roundtables several days prior to the Congress that are focused on different nosologies, different problems, so that on the plenary session we would be able to discuss more systemic problems. And as an example of our achievements, it has been a long journey for us. In early 2000s or late 1980s, in the last century, we could not even think about us being able to modify federal laws thanks to our activities for programs with drug accessibility benefits and so on. So maybe I should skip all the tiny details. You can see this list on the slide in front of you. And this is the example of our achievements. But I will repeat again, it is about changing the regulation in the area of drug registration. It is about the Circle of Kindness Foundation. It is about submerging new methods of treatment and drug access programs in the program of mandatory governmental guaranteed access. Also, it is about off-label application of drugs. Maybe it's a technicality, but still it is about defending patients' rights. It is about complying with patients' rights when there are some violations in terms of provision of the drugs, drug access, or some problems when due to some reasons a patient cannot get the required drugs in a pharmacy. So here we also work together with our partners. Well, dear colleagues, that's basically the main scope of my presentation. It is far from being complete. This list of the areas of work that are currently being done in Russia, and I can really talk endlessly, but I believe that these should be the key highlights for my today's presentation at our meeting. And indeed, I am now summarizing as a presenter. As a co-moderator, I want to say that today we have had very interesting presentations that confirm the main idea. We come from different countries, different nationalities, different ethnicities, different cultures, but we are united in our strive to defend patients' rights and to strive to expand medical and social care for our patients. And we can see how similar the forms of our activity are in different countries. And I would also like to thank the organizers of this forum, of our orphan consortium, for both CIS and BRICS countries, because these prospects of exchanging knowledge and experience and collaboration are really valuable, very valuable for all of us and for our global colleagues. But now I'm happy to give the floor to my excellent co-moderator, to Prasanna. Prasanna Shirol, please, the floor is yours. And this will be the concluding remark for our session.
Thank you, Uri. I think it was an excellent Hemophilia Society. You can see 37 years of experience. I think wonderful job, wonderful work. Even in India also, hemophilia started much earlier in 80s, 86, 87 types. I think that is where the advocacy started. We have a lot of things to learn. And also thanks to all the panelists today who have given their inputs, ideas for wonderful experience of their country. Lot of takeaways. There is a lot of learning within ourselves. We don't have to look around. Okay, and especially Dureen who spoke about the importance of regional alliance, because while we can collaborate across the world for various things, but regionally also it makes a lot of difference because there is a lot of commonalities. Okay, a lot of similar challenges both in terms of the patient groups and also from the government side. I think that is the key takeaway. And one thing which is emerging is, and which is always uh, the challenge is the sustainable access or of funding. I think this is the main challenge everywhere. And Circle of Kindness is an excellent example, which I'm really impressed. I think all of us should take this, forward in our countries, because it is like, in India we also have CSR, contribution, which is already mandated some 2% of the companies on a threshold. Okay, there is a lot of amount, but that is for the general use. While Circle of Kindness is for specifically rare disease. I think I am looking at a solution where we can reach something and bring a collaborative model and build some corpus. Similarly, I think BRICS countries come together also poses similar challenges. If we work together, even among the BRICS as a community, even in the rare disease, I think it may help is what I feel. And one thing is no doubt, undoubtedly, the collaboration is the key. We need to learn, we need to understand, we need to follow each other, employ best practices of each global friends. I think that is the way forward. So I thank all the speakers for their valuable presentations, inputs, ideas, and for collaboration. Thank you. Thank you for being a co-moderator and also speaker in this session. Thank you. Thank you, organizers. I think we can close this session.
Thank you. Thank you very much indeed.